this is a really anterior frenulum and a really thick one that's coming from the underside of the tongue right down to the back of the gum. And then on the right hand side there, you can see what happens when that's released. It opens up into a diamond. Now that diamond shape has to repair, and you get sort of like a wet scab over it, so it looks like a ulcer. And what potentially happens is, as that heals, it can contract down and thicken, and that those sometimes need to be re-released. What we want is for the floor of the mouth to repair with that kind of new sort of height and release to the tongue function, and that's what we're trying to achieve. So you've seen there where the tongue was only able to lift, about a centimetre from the gum. Suddenly it's free to lift all the way up, and that's what we're trying to keep, to allow the tongue to keep its function.
So how do you encourage that to remain the case after that drastic frenulotomy there? Presumably feeding is going to help, but what can you do to prevent it from shortening, thickening and becoming less effective, less functional?
So within the NHS, they don't recommend anything other than regular feeding. So with a young baby, they'll just recommend that the baby's fed every 2 to 3 hours. Within the Association of Tongue-Tie Practitioners, we recommend non-invasive oral exercises. So that would be doing things like sucking onto the parent's finger and gently tugging the finger away as the baby suckles, allowing the baby's, so that the tongue is hanging onto the finger and moving it. Encouraging extension by tapping on the baby's lips to get the baby to bring their tongue forward. And also the parent being able to hold and look at the baby's sort of about 30 centimetres away where they can focus, and stick their tongue out at the baby because they'll mirror it. And you can also do lateral exercises where you're just rubbing either side of the gums to get the baby's tongue to go side to side. So really what we're doing is what we call physio or oral play. In my opinion, it should always be something that's fun for the parents, pleasurable for the baby. They enjoy doing this, and it should never be anything that's stressful or painful.